Hello everyone. So today I want to discuss one thing that's very common, and that is muscle knots right in the mid-back, right next to the spine, usually on the rhomboids. Now, what's happening there, it is probably a trigger point, but here's the thing, you're probably self-treating it with a lacrosse ball. Now that's awesome, and you might have a one-off experience where it fixes it, it's probably not going to be permanent, because we have to take into account our full anatomy, and not just that, what muscles blend into others, what is formed back there, and what our biomechanics are going to dictate in terms of form and function. So, looking at a knot, usually right there between the scapula, the medial border, and the spine, right in the thoracic region. Now, it's important we understand the connection the rhomboids have to other muscles and their effect on the scapula. If this muscle is not performing correctly or efficiently, or not allowing things to slide and move, we have issues. Now, one thing I want to highlight in this video is the rhomboserratus sling. The rhomboserratus sling is obviously what it sounds like. It's a combination or blending and working together of the rhomboids and the serratus. Now the serratus runs from the ribs over here, obviously, through underneath the scapula and attaches right into the rhomboids underneath, forming the sling. Now this allows you to bring your scap back and move it efficiently into upward rotation and downward rotation and all around in an efficient manner. If that muscle is dysfunctional, a knot is going to occur. But you going at that source of pain, that trigger point, is not going after the source of, once again, your pain. It is chasing symptoms. You need to make sure, biomechanically speaking, you are moving efficiently. And to make sure you're moving efficiently, once again, check your function, check your form. How are you moving? Check your posture. Are you sitting like this? Sitting like this in a kyphotic state is going to lack or make you lack overhead motion, which puts great strain on the muscles back here into a lengthened position, causing dysfunction long term. If you don't fix that, that being the source of your pain, you are not going to see long-term adjustments or permanent change. So that's just one example, but you need to make sure your passive, your active assisted range of motion is okay. Anything, every single range of motion possible that you can have or own, you need to make sure we have, and once again, own. So check your range of motion, evaluate yourself, reevaluate yourself. Don't just stick a tennis ball in there. Or, further suggestion, if you're going to stretch, if you're going to put a tennis ball in there, do acupuncture, do massage, follow that up with movement patterns. Reevaluate yourself and make sure you're moving efficiently. Can you get back here? Do you have full extension? Do you have full shoulder flexion? Abduction, adduction, internal, external rotation. Check all these things because they all mesh into one another. Your body is one systemic whole. But if you treat it with one little tennis ball on one spot, you are not treating the person as a whole. You are chasing symptoms, and we don't want to do that. So check yourself, evaluate, reevaluate, range of motion checks, manual muscle tests, check your posture, check how you're standing, check how your toes moving. Everything moves up and relates to one another. So think about that. Have a great night.